Following the development of a vaccine to prevent the transmission of diphtheria disease in Nigeria, health stakeholders have called on citizens to take advantage of the vaccine to curb the spread of the disease. This was as they met with media stakeholders in Abuja, calling for more awareness and education on the disease. Marvelous Obomanu has details.
According to health stakeholders, Nigeria's recent diphtheria outbreak has been its most telling in recent times. Health experts, including international development partners, say there is a need for more education and awareness of the disease.
This is the largest outbreak of diphtheria that the world is witnessing in many years, and it is happening here in Nigeria. So it is very, very important that you also understand that your role is very critical as our media partners, because without you, we cannot, not just disseminate information, but we will not be able to change the behaviors that are needed to change, around, health-seeking behaviors that we want to promote, and then change behaviors around even as we address the outbreak.
The United Nations Education Fund met with media experts from across the 7 states, mostly affected, urging them to go beyond one-off reporting and reach out to those in rural communities in steps needed to curb its spread.
Try and move beyond the headline. If we stop only at the headlines, we're not helping our colleagues. We shouldn't just make one announcement and that's it, right? Because when did this outbreak start? People are still dying, okay? Kids are still dying. So we need to move beyond just our headline stories into in-depth coverage of what is going on, into generating human interest stories. How are people suffering from these diseases? Those who have lost loved ones, what is the impact, on them? How did they see their own loved ones whom they could have saved dying from, a vaccine-preventable disease?
They also expressed worry over the attitude of citizens, saying that since the development of a vaccine in September, some Nigerians have been hesitant to accept the vaccine.
There is a vaccine that is being used for the prevention of the disease. But however, evidence because we started this fight since early, I think in September. But the results show the suboptimal coverage. Due to what? Due to hesitancy. There are a lot of hesitancy, which is being fueled by a lot of rumors and misinformation. So it is therefore imperative that we all put our hands together to see that we ensure that all Nigerians are protected against this deadly disease. And also this misinformation and rumors and then theories on conspiracy are also dragging the whole program down.
Health experts say that since the discovery of the vaccine, there has been a significant reduction in the cases of diphtheria. They urge the public to continue to adhere to prevention and treatment instructions put in place to tackle the outbreak. Marvelous Obomanu reporting for News Central.
To discuss this, we're joined by Dr. Abubakar Baba, a consultant clinical microbiologist, UMTH. Thank you very much, Doctor, for giving us your time.
Thank you for having me.
How effective is diphtheria vaccine in preventing the transmission of the disease, and what are its potential side effects?
Diphtheria, like I rightly said, is a vaccine-preventable disease, and over the years, the vaccine that has been well established and well developed and very effective in combating diphtheria. Now, the primary problem we have is not with the vaccine, because the vaccine has been universally accepted, tested, and it has been with us for very long period. And the next question was, I can't remember.
Yes, I'm asking for the potential side effects if any?
All right, okay,
Yeah.
yes. Side effect, yes. You see, the major problem here we have is side effects like any vaccine. You see, the vaccine is in a combination. We have it in, we give it to children in penta. Now, as penta, a combination with other vaccines. Now, the major side effect that people complain of is the inoculation site because it's an injectable. When you inject, there will be pain in the site, swelling, and these babies come down with fever because it is more than one vaccine. So that has been the major, so we will not call it side effect, but we will say one of the drawbacks of the vaccine. And that makes mothers hesitant in taking the vaccine based on that signs and symptoms, pain, fever, etc. And it has been well established, and these are things that we really need to tackle.
You mentioned mothers, so I'm assuming babies are specific here, or are there specific populations on age groups in Nigeria that are more vulnerable to diphtheria? If that is yes, how can we target vaccination efforts towards them more effectively?
Yes, it's a disease that affects the children. So the target age is from 1 to 14, and those are the people that are vulnerable, the babies. Why I mention the mothers is because the mothers are the ones that will bring the babies for vaccination and immunization. They are the ones that will are the custodians of these babies. So they have to be educated actually. So those are the target areas. That is why if you look at the immunization schedule, we give them in batches. Booster doses 1, 2, 3, with a complete vaccination to complete the whole dose for them to acquire the full immunization.
All right. In addition to vaccination, what other preventive measures or strategies can individuals and communities adopt to reduce the risk of transmission?
Yes, very good. Yes, because it's a known based on the epidemiology of the disease, the clinical cause. It's a problem of people who are, because it's an aerosolized disease whereby people come in crowded areas, through direct contact with droplets, droplet infections, and then cough. So you discover that if you minimize this droplet infection, aerosolization, crowding areas whereby you have poverty, you have people crowded in an environment, with that, I generally use what we call IPC measures in aerosol to protect airborne diseases. So by wearing masks, cleaning your hands, all those general IPCs like what we did in COVID. Once you do that, you keep away from droplets and contacts. Definitely, we will combat it.
All right,
we
Doctor.
tend to see these things in areas where you have especially IDPs, internally displaced people, poverty, where there's no proper
hygiene,
ventilation, etc.
All right. Thank you very much, Doctor, for speaking with us. We appreciate your time.
Thank you very much for having me.